What if your heart suddenly started beating 150, 180, or even 200 times per minute? A racing heart can happen after exercise or when you're nervous, but sometimes, a very fast heartbeat can be caused by an abnormal heart rhythm. This is called tachycardia. So when is a fast heartbeat normal, and when could it be a warning sign? Let's find out. Welcome back to Heart Lifelines. Today, we're talking about tachycardia, a condition where the heart beats faster than expected. We'll look at what tachycardia is, what causes it, the different types, symptoms to watch for, how doctors diagnose it, and how it can be treated. What is tachycardia? For many adults, a resting heart rate between about 60 and 100 beats per minute is considered typical. When the resting heart rate is consistently above 100 beats per minute, doctors may describe it as tachycardia. But here's something important: a fast heart rate isn't always dangerous. Your heart naturally beats faster when you're exercising, experiencing stress, feeling excited, or trying to respond to something happening in your body. For example, if you sprint up a flight of stairs, your heart speeds up to deliver more oxygen-rich blood to your muscles. That's a normal response. The concern is when the heart becomes too fast without an appropriate reason, especially if it causes symptoms. Different types of tachycardia. There are several types of tachycardia. One common type is sinus tachycardia. This happens when your heart's normal rhythm speeds up because your body needs it to. It can occur with exercise, fever, dehydration, pain, anxiety, or certain medications. Then there are tachycardias caused by abnormal electrical activity in the heart. For example, supraventricular tachycardia, or SVT, can cause episodes of a suddenly very fast heartbeat. Another type is ventricular tachycardia, which starts in the heart's lower chambers. Ventricular tachycardia can be much more serious, particularly when it occurs in people with underlying heart disease. What can cause tachycardia? Tachycardia can have many different causes. Some common triggers include exercise stress or anxiety, fever, dehydration, anemia, and overactive thyroid. Certain medications or stimulants, large amounts of caffeine in some cases, are caused by problems with the heart's electrical system itself. Previous heart damage or certain heart conditions can also increase the risk of abnormal fast rhythms. That's why doctors don't simply look at how fast the heart is beating. They also want to understand why it's happening. Symptoms. Some people with tachycardia don't notice any symptoms. Others may suddenly feel their heart racing or pounding. Possible symptoms include heart palpitations, shortness of breath, dizziness or lightheadedness, weakness or unusual fatigue, chest discomfort, fainting. Symptoms can vary depending on how fast the heart is beating, how long the episode lasts, and whether the heart is otherwise healthy. If a rapid heartbeat is accompanied by severe chest pain, fainting, severe difficulty breathing, or significant weakness, seek emergency medical attention. How is tachycardia diagnosed? Doctors may begin by checking your pulse and performing an ECG, or electrocardiogram. An ECG records the heart's electrical activity and can help identify what type of rhythm is occurring. Because some episodes of tachycardia come and go, a doctor may recommend wearing a portable heart monitor for a longer period. Blood tests may also be performed to look for possible causes such as thyroid problems or anemia. Depending on the situation, doctors may also perform an echocardiogram or other heart tests. Treatment depends on the type and cause of tachycardia. If the fast heartbeat is caused by something like fever, dehydration, or another medical condition, treating the underlying problem may help. Some abnormal rhythms can be treated with medications. Certain types of tachycardia may require a procedure called catheter ablation, which targets the abnormal electrical pathway causing the rhythm. For people at risk of dangerous ventricular rhythms, doctors may recommend an implantable cardioverter defibrillator, or ICD. Not everyone with tachycardia needs treatment, so proper diagnosis is essential. A fast heartbeat isn't always a sign of something dangerous. Sometimes, it's simply your body's normal response to exercise, stress, or illness. But when your heart suddenly races without an obvious reason, or you experience symptoms like dizziness, chest discomfort, shortness of breath, or fainting, it's important to take it seriously. Your heart has a rhythm for a reason. Understanding that rhythm can help you better understand your heart. Thank you for watching Heart Lifelines. We'll see you in the next video.